Sunrise, NBC5 News, and Asante continuing to team up to bring you better health.
This morning, we're talking about aquatic therapy and why it might be a good option for you. It's time for Better Health, and I'm here with health expert Beth Coker with Asante. Thank you for being here.
Hello.
And this morning we have Alex Bennett, a physical therapist with Asante. This morning we are talking about pool therapy.
So Alex, pool therapy or aquatic therapy is an important tool for a variety of patients recovering from surgery or a serious injury. Who can benefit from aquatic therapy?
That's correct. Anyone can benefit from aquatic therapy, and that's the distinction between aquatic therapy and pool therapy. Is this isn't a big swimming pool that we're having patients get in. It's a therapy pool, which is rather shallow, and there's no swimming involved. And actually, the benefit of being in the water for your therapy is reduced weight bearing because of the buoyancy effect of being in the water. Really, anyone can benefit, but the people who do benefit the most are people who are having trouble tolerating land-based exercise. So that includes people preparing for surgery, recovering from surgery, even people with neurological conditions where they just can't tolerate the exercise for whatever reason, some impairment or pain.
So being in the water helps reduce some of the stress on the joints and movement and things like that.
Exactly.
How does the water give them the resistance they need for therapy?
Well, water is about 600 to 700 times more dense than air, so trying to move your limb through water is a little bit more difficult. So you're getting some resistance training based on how fast you're moving. The faster you try to move through water, the more resistance you get. So that can really help people get stronger faster if they're having trouble tolerating exercise on the land.
So if you have a patient who's deathly afraid of the water, how do you convince them pool and the aquatic therapy is the way to go?
The first thing I do is I show them our pool to show them that this isn't this big, deep place. And if they're really reticent, I'll get in the water with them so they feel extra safe there too. And we run into people saying, I don't want to get changed into a bathing suit. It's been years since I've even done that. And you really can wear whatever you're comfortable in for that too. But I do respect people's fear of the water if they do have that. But I try to give them as much information as they can about why it's beneficial so they can make an informed decision before they.
So Three Rivers Medical Center has a beautiful aquatic pool to do the therapy. What if I don't have access to that pool?
There's pools in the community that we'll encourage people to get into. Certainly you can't come to therapy forever. So if you are benefiting from aquatic therapy, we do encourage that you seek that out in the community, whether that's at a local gym. Some folks have even used the neighbor's pool. Some folks have even gone to see if they can rope their way into using a hotel's pool. They've just found it that beneficial for them.
Thank you so much for that information. Great hope out there for people who land-based therapy is not working.
Quite right.
Thank you both for being here. We'll be right back.